Hi there, my name is Dr. Katrina Cox, and I'm a naturopathic doctor and the author of The Opportunity in Cancer. I wanted to come on today and talk about a really big topic, exercise. And this topic is really important because I think we need to break through the gym culture and understand that exercise is actually not the thing that needs to happen, it's body movement. And there's so many reasons why this is a really important statistic or a really important thing to engage in for cancer survivors. One of them is that by moving our body, it decreases cancer-related fatigue and cancer treatment fatigue by 30 to 50%. So that's huge in the realm of recovery, especially post-treatment and especially post-diagnosis. It also reduces our risks of cancer reoccurrence. And more importantly, we have to understand how our muscles change during the course of the disease of cancer and through the treatment of cancer. There are plentiful outcomes that show that the body movement, that body movement can actually decrease these changes, and the benefit is huge to those that are surviving and want to transform to thriving. So my most important thing that I tell people is it's more than an equation of to gym or not to gym. We have to break through the gym culture. The gym can be very, very helpful. It can be motivating. It can be social, but a lot of us don't know where to start or how to even start. And so what I just tell people is it's little things. The most impactful conversation that I had that I can remember with a patient was there was a patient that I knew and she was a glioblastoma survivor. So not only did she struggle with, the treatment of cancer, but they also had to cut open her brain in order to remove parts of the cancer. And because of that, things on the left-hand side of her body and the right-hand side of the body didn't work the same. And so we really struggled with getting her to move because she was so unsteady on her feet. And she had high expectations because she was a runner. She was an avid runner. And so what we ended up having to do was just do small things. Start by every time she sat down, she'd stand up and sit down 6 times. And then we'd start by just taking a lap around the living room. Nowadays, she actually walks up to 7 kilometers a day. She's never going to run again. We've discovered that when she runs, it actually increases her risk of having seizures. But what we did find out is that she can walk for long distances. And the most important part about this physical body movement is that you have to remember it's all the muscles of the body that need to recover. So it's not just your physical skeletal muscles, but also your heart and lungs. And so if we really work on those parts, we're going to kick in those mitochondria that we were talking about in some of our other videos, which will allow for us to make more energy. So that's really, really important. So what I work with my patients to discover how body movement works for them is I have something called a flower model. And on that flower, it's like to gym, to not to gym. And so you can pick the petals and just try to find the petal that makes sense for you. Is it dancing in the kitchen with your friends? Is it standing up and walking in a forest? Is it jumping rope? Is it simply, just going to the mailbox? Whatever it is that makes your body move will be the most important thing that you can do for you as a cancer survivor that wants to transform to thriving. Remember that moving our body every day in some small way is the most important first step. So if you can do that, you've got thriving in the bag.